Corazón, tú eres un hermano, tú eres mi familia, da igual idioma tu país, tú eres mi familia. Okay, so if you know me at all, you know I'm going to be singing because that's what I do. That is part of my wellness program. Welcome to Wellness Wednesdays, and I'm Kimberly Adams Tufts. Kat, to those who, most of those who know me, or Kim, to old friends and family. And so this Wednesday, we're going to talk about how we can avoid, or you can avoid, getting sick at work. So let's talk about fomites. What's a fomite? Well, that's a fancy term for a hard surface. So that's your doorknob, that's the refrigerator handle, that's the stove handle, that's the elevator button. And so fomites are a fancy term, as I've said, for hard surfaces. Microorganisms or germs like viruses, common cold, bacteria, and fungi or fungus like to live on hard surfaces. And they can live on hard surfaces for quite a few hours or sometimes even days, but that depends on the specific germ. And in the workplace, we often come in contact with what I could call germ hotspots. It's the elevator button, the microwave, so maybe we need to go back to eating those old P&Gs, or maybe better yet, have a salad for lunch. The water fountain. Think about the workplace kitchen, for example. Think about the refrigerator and once again the microwave. Lots of people touch these each day. However, it wouldn't be an issue if everyone practiced good hand washing. So if you think about what we discussed on Monday, we talked about 5 tips for decreasing our risk for getting the coronavirus or COVID-19. And number 1 was hand washing. So if we talk about practical tips for avoiding getting ill or decreasing our risk for getting sick in the workplace, number 1, once again, is hand washing. 20 seconds using lots of friction, because we don't want germy hands to touch our surfaces like the handle of the door, or coming out of the bathroom, or even worse yet, touch our germy hands to our face. And interesting too, so that's tip number 1. Continue to use good hand washing hygiene and limit touching of the face, particularly the eyes, the nose, and the mouth. Secondly, you can disinfect hard surfaces and do it quite regularly. And you don't want to use the same old wipes over and over. And you know, I must really be such a nurse. And as you know, I am a registered nurse and a board certified nurse practitioner and wellness coach. Well, I meet that criteria because look, when I was looking around today, I realized that I had Lysol wipes in my office. This is my second office, but I had them. And well, you know, Costco's had them on sale, and I bought them in bulk, and I thought, well, I could clean off my fake wood office desk with those. So if you happen to have some of those handy, don't use the same old one. You want it to be moist and have the disinfectant in it, and you can wipe down surfaces in the office place with wipes. So number 2, disinfect hard surfaces. Number 3 of the 4 tips we're going to talk about today is to limit handshaking. I know we all love a good handshake, and it's considered a standard in most business places in the United States. But hey, why not go back with the old bump? Bump elbows. That's right. It's back in style. Bump, bump. Avoid the handshakes. Number 4, and this is a biggie. After you wash your hands and you've done really, really well with good hand washing technique, don't go to the bathroom door in the building that you work in and touch your hand to the doorknob after you've washed your hands. Because guess what the dirtiest place in a bathroom is? The doorknob as we walk out. Because everyone doesn't wash their hands or doesn't wash their hands thoroughly. And so I've really been known, and I've probably been seen in quite a few places, taking the hem of my dress and lifting it up and opening the door. or taking a paper towel if they are available. After I wash my hands, instead of throwing away the paper towel, and you can do this too, take that paper towel, turn the doorknob, and then throw it away when you're outside of the bathroom. So some practical tips for avoiding getting sick in the workplace: wash those hands, disinfect hard surfaces, limit handshaking. You set the norm in the office. You know, you be the one that sets the new trend. Bump, bump. And don't touch your hands to the doorknob of the bathroom after you've washed your hands. But you know, in all the things that are going along in the last couple weeks and on the media and every day, there's a new report and some new number that might seem to be awful scary. I think it's really important that we put this into context. One of my colleagues this morning, someone up in New York, said to me, "Kat, we have to talk facts over fear." Someone else who's in infection diseases. And I thought that was really interesting, because all we hear about is the coronavirus. And do you know that most people who get the coronavirus will have mild symptoms and they'll recover? But if we want to put it in context, we want to think about these practical tips are for decreasing our risk for any kind of sickness during the cold and flu season. I looked at the CDC website, and do you know that some 45 million Americans will have the flu in the 2019-2020 flu season? Yes. And unfortunately, approximately 18,000 of the 45 million will die from the flu. And we know that significant numbers have died from the flu already, but we're not talking about that. So I want to have you keep that in context. Also, I have to say that we all have healthy germs, and being exposed to germs is foundational to our overall health. We have to come into contact with a certain number of germs to boost and build and edify our immune systems. Think about this. They don't play the Super Bowl, say, okay, without ever practicing or having had, I don't know how many games do they have in a season. I don't know. But I know they play a lot of games and they practice a lot before they go to the Super Bowl, because that's how they boost their capacity to be successful. Also, I thought about this. Here's J-Lo up there jumping around in the Super Bowl show, and I thought she had to do a lot of practice before she could do those backflips with ease. So our bodies are the same. Our natural systems are built up by practice runs with colds, flus, and other viruses. So in the box below, I've provided 5 resources. The first one, because we can go back to those foundational tips I gave you on Monday, we want to wash our hands, limit touching our face, cough into our elbow, sleep well, and eat better. So in the comments box or the description box, I've put something for how you can treat insomnia naturally without medication. And that's by Abraham the pharmacist. And he's really pretty darn entertaining. And then I love Sanjay Gupta, and grand neurologist from Atlanta and works at CNN. And there's a short segment about 5 foods we should never eat. Then also scientific information from the Centers for Disease Control and Prevention once again. Also some information that came hot off the press yesterday about efforts to develop coronavirus testing kits. And then last but not least, if you'd like to dwell a little deeper and put this into context, some 2019-2020 estimates about the flu and its impact on our nation at another CDC website. So that's all today for Wellness Wednesday. Thank you for joining me, and have a wonderful day. Pase buen día.